But Hanne Bebendorf Scheller has the next presentation, and her presentation is called "To Change the Habits, Daily Commuting and the Public Health." Please.
Thank you. Yes, my name is Hanne Scheller. Bebendorf is very, very hard to pronounce, so it's just Hanne Scheller. And I work for the Danish Cancer Society. But before I will talk you through my agenda, I want to tell you a little short story about how it is to live in the most bike-friendly city in the world. This is Copenhagen, and I know that Klaus Bondam has told you a lot about Copenhagen, nice cities, and so on. So here we have one of the most livable cities and most bike-friendly cities in the world. I live here, and 2 years ago I wanted to buy a bed in IKEA up there. And because I really like to bike, I figured maybe I can just borrow a car and bike there. And I found a car there and wanted to bike there. So I go out of my apartment, grab my bike, and of course it started to rain. It literally rained cats and dogs. So I thought, hey, I just use this great transport system we have in Copenhagen and take the S-train. And the S-train station is here, not very far from my home, where you can take your bike for free. So I go to the S-train, want to take the elevator, but the elevator is broken. So I think, oh, that doesn't matter. I take my bike over the shoulder, go down the stairs, and are ready for the train. And I think maybe a minute before the train arrives, this very, very polite speaker voice says, the train is coming at the other side, on the other perron. So I grab my bike, run up the stairs, over the bridge and down the stairs again, and are ready for the train. And I just see the train coming on the other perron. So, and it was raining and I was like a little bit tired, so I thought, all right, the next train is coming for about 20 minutes, so maybe I can just take the metro, because here you also can take your bike. The only thing I didn't think about was that here you have to buy a bike ticket, and this, of course, I forgot because it was chaos and it was raining. I got my bed in IKEA, but if you don't remember anything else of what I'm going to say to you afterwards, here's the point of my whole speech. I just have to find it. Yes. If you don't, it doesn't matter how motivated you are to choose a certain behavior, for example, bicycling, if the system that is surrounding the behavior doesn't work or has a failure or anything else. So I'm going to talk a lot about the system around behaviors more than the internal motivation to do something. Yeah? And here's my agenda. I shortly will present the Danish Cancer Society. Afterwards, I'm going to talk about health prevention and cycling and tell you why do we bother as a health organization. Then I'm going to talk shortly and briefly about some theories about changing habits. And then I'm giving you some examples of the work that we are doing in the Danish Cancer Society. And then I have some recommendations for you. More cycling, where to start. And in the end, I have 10 minutes for questions. So let's start with the formal stuff. The Danish Cancer Society is Denmark's biggest health organization, and in Copenhagen we are 500 employees working at the headquarters, and we have 400 employees in Denmark in our local departments. We work, and here's just an organization thing. I thought, yeah, you can see the slides later, I was told. And our vision is to work for a life without cancer, and we have 3 strategies. We want to prevent the development of cancer, we want to improve recovery, successful recovery, and we want to limit the physical, psychological, and social side effects of cancer. So this is what we work for. We are a non-governmental organization that is privately funded. We have about 500,000 members and 40,000 volunteers. Most of them go around with those, on Danish it's called raslebøsser. I don't know the English word for it, but they just ring on a clock and ask if you want to donate something for our work. And then once a year in whole Denmark, all Danes are asked for that. We are 900 employees and we have a total income about 500 million kroner, and half of the money is going to cancer research. So we have a lot of scientists in our house. And now is the why am I here and why am I going to talk about cycling. Every third Dane gets cancer and 4 out of 10 cancer incidents can be prevented. And after smoking, overweight and physical inactivity are the most important factors related to cancer development. So we have some statistics in our company, and we figured that about 5,000 cancer incidents could be avoided if all Danes followed the recommendations for physical activity, which is 30 minutes a day, and healthy nutrition. So that is the why. In my department, we work with the risk factors of cancer development, which is tobacco. You all know that smoking kills you, so I don't want to go into that. I work with nutrition and physical activity, where we want to make it easy for every Dane to move every day and eat healthy. We also have some campaigns, sunscreen campaigns, alcohol campaigns, and some screening programs and vaccination programs in my department. And here's our strategy in my group, where we work. We always want to find more evidence because we want to know what does work and what has the right effect. So all our work is based on evidence or evaluations, and out of that we develop structural prevention projects. I'm going to talk more about that later. And we communicate, and the whole point is that Danes are going to change their behavior, and because they change their behavior, we get less cancer incidents and a better survival for everyone. So that's our strategy. If you're really interested, you can go on the homepage and read more, because that's not what I'm going to talk about. And the evidence about active transport is that everywhere, when you study physical activity as I did, everywhere active transport is pointed out as the best strategy for counteracting populations increasing inactivity, because everyone has to go from A to B in every day actually. So some people counted on it, and in Denmark about 4,500 deaths and 10,000 hospital inpatient treatments and 3.1 million days of absence caused by illness can be avoided by cycling. So that's actually quite a lot. We also made another counting that the healthcare system uses about 3 million Danish crowns a year related to physical inactivity. So if you can make people move more, you can also see it on the money in the other side. And cycling has a great health potential. And Danish science shows that cyclists have 30% reduced risk of early death. And even short trips can make a change for people. So that is why we are very interested in cycling. Every Dane has a bicycle, and almost all Danes can bike, and we also have an infrastructure that works. So that is why we bother about cycling. And now I'm going to talk a little bit about to change something. Science has focused a lot on how we get motivated to change any behavior. And earlier different behavior scientists focused on individual factors like internal motivation and intentions, attitudes, norms, and self-efficacy, and so on. Here you see the model of Eitzen, which is the theory of planned behavior. It's used for a lot of transportation science because he also made a questionnaire, and if we want to ask people how they transport themselves and what they want to do, he made this questionnaire for it. And it's I think it's he made it in the 80s and developed it through the years. But all these theories could not really explain why people still don't work out more often or still eat candies and chips when they sit in front of the television. So even though they actually had a wish to change or had a wish to lose some weight. So newer findings show that the systems around a certain behavior are more important than your internal motivation or your internal wish to make a change. And here is a model from Sallis. James Sallis and colleagues, they developed this detailed model. I'm not going to talk you through the whole model, I'm just pointing some things out. They just tried to figure out, okay, what do we know? We know something about psychology and social science and sociology. Thank you very much. And they sat together and combined all these theories and figured, well, if we have a behavior which is the yellow circle, there we can see that there's a potential of being more active. So transport is one of them, leisure time and household activities are two of the others. And some of the factors can be explained by internal factors, which is the thing in the middle, but some things must be explained by the policy environment, because we can't explain that people don't make a change if they do, if we don't see, look around the structures that's around. So, for example, transport is a part of your everyday life and a domain for activity. This domain is influenced by intrapersonal factors like family status, gender, income, and so on, and also psychological characteristics, but also the policy environment as regulations and transport investments. It goes both ways. So this model explains more than just my wish to do something, because I'm also getting primed by the system around me when I want to bike in Copenhagen, for example. So if you don't know the model, please take a look at it. It's very interesting. And if you want to do something else and take a change and do it the other way, then you have to have a realistic and a possible healthier choice. Otherwise, you can't make this choice. So if the system isn't available or convenient, or you don't have the possibility to bicycle because you don't have a bicycle or bicycle paths, or the weather is just bad all the time, then your internal wish to do something else doesn't really matter. But you also have to want to do something else. You have to be motivated to see the possibilities in the system. So it actually goes both ways. Okay? Yeah? You with me? Good. And if that's not complex enough, it gets a little bit more tricky. Because the system's composition in certain behaviors is affected directly and indirectly. So another scientist, Kramers, differentiated behavior in automatic actions and conscious actions. And with the roots in social psychology, all informations that are received in our brain every day, every minute, every second, are received and processed all day long, every day long. So all informations you get, you either get in automatically, or you actually get a new information and say, hey, now the weather is good, so I want to take my bike. And this model is called the dual process theory. Because the duality is caused by the environment's simultaneous direct and indirect affection on the individual's behavior. So even though I think that I have made a choice of biking in Copenhagen, the culture in Copenhagen and the infrastructure and what my boyfriend does affects me even more, because automatically I'm part of a system and I do like what everybody else does. So I can take a choice, but I'm always I'm always affected on other things that happen around me, and I'm not always aware of why I'm primed to bicycle or why I'm primed to take my bike. But it's also very interesting and very tricky, and I could just keep on talking about it, but I won't, because I think it's easier to give you some examples in a minute, because it's a little bit complex. Like I said, we think that all our decisions are made conscious, and because we want to be those who have control about ourselves and so on. But a food scientist, he just counted, I don't know how, but he counted how many daily food choices you make. And you make over 600 a day, every day. And it's just the food choices. It's what you eat for breakfast, and when you're down at the cafeteria and there's a buffet, then your food choices are even bigger than those. And when we also have to make choices about our transport and how we want to raise our kids and about our colleagues and stuff, so you really make a lot of choices, but most of your choices are automatically, because our brain can't filter all the information all the time, because then we would just lie down and be very, very tired all the time. So, what is the point of all this talk? The important thing is that if you want to change something for people so that they can do something better for their health, for me it would be cycling or eating healthier, then you have to change the reality at moments where the choices are made. So you have to be out there where the user is, where he is going to take the choice. Sometimes it's at home, but sometimes there are some other arenas where you can work. This is called nudging, choice architecture, or structural prevention. And this is what we work with in my group. And just to make it more concrete, I have brought you some examples here. Oh, there's a picture missing. Now it's going. Yes. At the supermarket is one arena where we work. The health problem is that we eat too much and often make unhealthy food choices. We also buy too much food that we throw out afterwards. And why do we do that? It's because we have like 10,000 choices, food choices we can make at the supermarket. And we work together with a supermarket chain in Denmark where we try to change the choice architecture by changing the space management. So it's like when you stand in front of the fridge with the Coca-Cola and the water is always down here where you don't see it, and the cola is always right here. Do you recognize that? Maybe? Then if you switch the water and the cola around, then people would more often buy the water. They still can just grab the Coke, but because they don't see it immediately, they would get more thirsty for water. It's really, really weird, but it actually works. So by priming the customer at the moment where the choice is made, then you actually can nudge the customer to make more healthy food choices, and we all want to eat more healthy, so it's a win-win. But the important thing is that you don't remove the more unhealthy choice in the situation. You just switch around a little bit, yeah? We also have menu boards, which is another project we have. The health problem is that we choose too big portions when we eat out. And here we can, there are two different ways of doing that. You can change the choice architecture again on a menu board. Behavior studies show that you always choose the menu left from the middle, this one. Think about it next time you are standing at the cinema and want to buy some popcorn. If we now just turned the menu board around, then every customer would actually choose this size of popcorn. The weird thing is that the popcorn industry would make a lot of money by selling smaller portions, because they actually earn more money by buying smaller portions of popcorn. But because they want to treat the customer, they want to nudge them to buy bigger portions. That's the one way to do it. The other way is to get some calories on the menu board that discloses all information you need. So you don't only need the price, you actually also could need the calories, because if you have to be aware of how much you eat, then you could see, well, I can still have a Coke, but it costs me 15 kroners and 200 kilocalories. So you don't remove the unhealthy choice, but you just make the full disclosure, and you can do it. There are thousands of examples, but those are two of them that we work with. And now to the thing that interests you more, I think, is during transportation. Here is the problem that our work gets more sedentary and we don't have time for exercise in our everyday life, and we always use our car for transportation if we have one. And so the solution could be that active transportation should be a natural part of daily physical activity, but the transport system have to meet the user's needs. They want to get fast from A to B, and they want some possibilities of intermodality. And as a part of the project, the revitalization of Copenhagen forts, we worked on a cycle strategy with 9 municipalities to establish an asphalted bicycle path. And the bicycle path is here, and I don't know if you know a lot about bicycle paths in Copenhagen, but this is the first that actually combines the big roads into the center of Copenhagen, so that you can go around through all the municipalities. And we were the neutral facilitator in this process, and actually it's one of the, we made some measurements, and with the super cycle paths from the region, actually they raised a lot, there were a lot of new cyclists using those cycle paths than before. So actually that's also a way to work out. Here I actually found a picture of the super cycle highways. So as you can see, there it's just the thing that combines these paths. Another example is the project From Car to Bike, where we work together with 4 different, very, very different workplaces up in north in Skagen. They made fish, and we have a hospital, a municipality, and a pension company. So we had a lot of different workplaces, and by working together to make some organizational changes at the workplace, at the HR strategy, or for new employees, they also got better facilities for cyclists, for example, bike parking just near the main entrance and showering. The cyclists were also nursed by free bike checks or reparations, and they all got some information that our workplace want you to bike more because we know it's good for you. So we make an extra effort for the bicyclists. We don't say that those who use the car are bad people. We just make a little effort for our cyclists in our company. And then some of the workplaces also made some campaigns, and we ensured by writing it in the strategy of the companies, or we try to ensure that the running of existing cycle activities would just not stop if the project stopped, but that it just would go further. And the last example I have for you is that you also can support existing infrastructure. Like I said, Denmark has a very good bicycle infrastructure, somewhere better than in other places. And the problem, it's not a problem, it's very good. The Danish government invests in the municipality's bicycle infrastructure, so the system, but still a lot of Danes, that is the problem. Still a lot of Danes choose the car as their primary transportation mode, also for trips under 5 kilometers. And every Dane owns like 1.5 bikes, and most of the Danes can cycle. So actually, if we don't have to talk about those who sit in the cars, but we just, and those who sit on bikes, if we just say that they are all people like you and me, who just take the transportation mode that is most convenient for them, how can we make them choose the bicycle more often or active transportation? So the solution was, or is, that possibilities for everyday cycling should be supported, and the population's focus on all unnecessary trips taken by car should be raised. And here we have a campaign that runs for the next 3 years. It's a partnership between 4 municipalities, 2 universities, ourselves, and 2 other health organizations, where we want to make a big campaign that is called Denmark Bicycles Together. And it has a clear message: bicycling is healthy for you and all trips count. We have a lot of interesting stuff in the campaign, but we just started, so if you're interested you can ask later. Yeah. And now to my recommendations. More cycling, where to start? Figure out which target group has the highest bicycle potential. We made some different investigations on that, and we saw that instead of focusing on gender or age or where you live has something to say, but we wanted to look at life phases. Where are you in your life? Are you at your education level where you don't have enough money to buy a car, so that's why you buy? But when you're finished with your education and get your first job, I just talked to you down there, is it the story that you think your parents have told you, that when you have your first job you also get your first car? So there's a possibility of changing something, because we can change the story about buying the first car if you have your first job. Yeah? The other one is families with teenage kids who hypothetically don't need a car to transport their children, because most Danish children want to bike and can bike, but the parents are like the biggest barrier to let their children bike. So they could actually also just let the car in the carport and take the bike for short trips. And the last life phase are elderly who don't have kids living at home anymore. They often actually own 2 cars and use them for most trips. So I don't know how it is in Iceland, but if you want to do something for bicyclists, figure out who has the highest potential of changing their behavior. The next thing is you have to understand the system, as I said in the beginning, that has an impact on the users, its bicycle infrastructure, safety, culture, and norms. To make an intervention campaign or to make some changes in the city's infrastructure for more livable cities, you really have to understand the system and the user's perceived experience on the trip. It's very interesting actually when you look at questionnaires where people who take the bike and people who drive by car explain what in verbs how their experience is. They actually always use the same words. It's flexible to bike and it's flexible to sit in a car. It's easy for me to bike and easy to sit in a car. So you really have to understand not only why do they sit there, but do they want to change? Back to your target group again. So you really have to get to your target group. And then you have to prime your user at the right moment with the right information. And there we have a lot of different users. I just brought you 3 examples. At workplaces, you could prime the user by having the first parking spots just removed and made them to bicycle parking spots. Because then everyone says, okay, here they actually do something for bikers, or they want people to bike, or there's something going on here. This is Novo Nordisk, one of the companies that were joining the Danish Cycle Federation for Cykelvenlig Arbejdsplads, and they really make an effort to make their people bike, still after the project stopped, actually. You could also make some competitions, again. You could join a competition with a Bicycling to Work campaign, for example. Other informations at the right moment, the right time, could be route choices or how many money you can save on gas. and so on. So you have to prime the user, and to know when to prime the user, you have to understand the system and know where your user is. Okay? And then make it easy to take the right choice often. This is really the tricky part. It sounds very, very easy, but all choices, when we look at the stages of change theory, for example, then there's this theory that says if you are motivated, then you make some effort to make a change, then you make the change, and then you just keep on making the change. It's very easy, you just do it every day. But actually, it was taken up to a revision because we always go back to this doubt of, is it really easy enough, and is it good for me, or do I have to make some other changes before? So you always take all choices up to a revision by the individual, especially when the behavior is not natural, when it's something new. If I had to run like a marathon, which I didn't have done yet, then I really, every day I had to consider, do I really want to run this far, okay? So to make it easy would be something like taking the bike for free in S-trains, like they did in Copenhagen, or to ensure that municipalities or the government invest in more bicycle projects and safe infrastructure. And here we work on a higher political level where you have to make some lobby work. Yeah. So make it easy is actually really, really hard, and there where the work really is done. And then if you have done all this, you keep on telling the positive story about cyclists, about the advantages and the health potential and so on. Because when you look at the media, they always try to make this big story about cyclists that are like crazy on the bicycle paths in Copenhagen, and car drivers who always drive like they may do for the law, and the cyclists are just cycling over for it and so on. So the positive story about that we all are human beings, and that we all have our behaviors, and that we all actually just choose what is most convenient for us. And if you want to do all those things, you need a lot of collaborators. You have to work with other institutions, public and private organizations, municipalities, scientists, universities, trade organizations, and so on and so on and so on. We do it in our company, where we establish partnerships, where every partner always has something to lose and something to win. And it's always about the money. Yeah. And with these words, thank you for your attention. Do you have any questions? You're just blown away.
Thank you, Hanne, for an inspirational talk. I wish that there's somebody from the Icelandic Cancer Association here. I'm not aware of that. And I want to ask you, do you think you could have the capacity and time to communicate with the Icelandic Cancer Society? Have you tried that before, for instance, with cancer societies in other countries? And what do you think they need to hear to be able to broaden their focus from scientific research on medicine over to prevention?
My answer is yes. There are some Nordic projects where the Icelandic and the Norwegian and Sweden and so on, they work together, but it's always on science. And this is also our hurdle inside of our organization. But even though that we make a lot of cool projects, then we still have a lot of scientists who actually work more on this cancer and patient part than the prevention part. So we talked about it, but then you had to come up with a great European project that could be tried out, where you had a protocol, for example, biking to work. There you have this European project. So we had to have a protocol that you could test in different countries with the same protocol. And it's tried before, and the problem is that the bicycle culture is so different in other countries, so you can't just copy an idea from Denmark and put it over to Switzerland, for example. You can try, but you have to make it fit to the country and the culture and the possibilities there. So, was that an answer to a question? Yeah.
That's another question on that.
Yes, thank you for your presentation and the organizers for organizing this event today. My name is Christian Andersen. I come from a town, the city council of Hafnarfjörður, south of Reykjavik. I bike frequently myself, just for practical purposes. One issue that has not been brought up here today, I think, is the use of helmets as a safety and health issue, if you will. There are arguments for and against.
Yes.
Do you have any opinions or anyone on the use, on when to use helmets? You know, sometimes I bike without a helmet and feel it's kind of politically incorrect to do that, you know, and, you know, what is the guideline on that, maybe, if you have any ideas on that or suggestions?
Actually, there is one big study that is made where you have figured out how the risk is for dying on your bike and how the preventional effect is on what is it on your health. And the risk for actually having an accident on your bike is much smaller than the health potential if you bike every day. But with that said, in Denmark we don't have a law about helmets, and we don't want people to bike and getting crazy and getting out in accidents, so actually we say use a helmet in our company. And we also work with municipalities to make safe bike routes for children and for grown-ups, so that it's not a question of am I going to be killed on my bike or am I biking for my health? So it has to be safe to bike. Yeah?
I would like to ask about life insurance. Have the insurance companies lowered the rates for people who cycle in Denmark?
Do you know that, Klaus?
No, they don't have.
No. But that's actually interesting.
I can add, I mean, because of course it's very difficult to prove. We would like, in the Cyclist Federation, we would like a stronger tax incentive. We would, in the Danish Cyclist Federation, we would like a stronger tax incentive to cycle. Today you only get deductions after 24 kilometers. And that of course depends on whether, I mean, it's the same whether you're a cyclist, use public transport, or you go by car, but we would like a scheme that actually makes it a good investment, also tax-wise, to cycle. And a lot of other countries do have that system already.
Sorry, my name is Morten Lange. I'm the chairman of the Icelandic Cyclist Federation. I think the question about helmet is off topic, but since it was brought up, as it is always done, I propose that people go to the website of the Icelandic Cyclist Federation and read about helmets there, and also bear in mind that it seems like helmet laws, which have brought about a sharp increase in helmet usage in many countries, that didn't seem to have an impact on the head injury rates. They were going down at the same rate for pedestrians and cyclists. So there was no response in the frequency of head injuries. This is a big discussion, and I think we should have perhaps a separate conference on it. It's not something that is easily answered. Thank you.
Einhverjar fleiri spurningar úr salnum? Ef ekki, þá segi ég bara 1000 takk fyrir þínu foredrag.
Selv tak.
Og her har du også en bog om cykelveje i Vestisland.
Tak for det.